The head of the first metatarsal bone and the metatarsal phalangeal joint are palpable at the ball of the foot. From the joint, probe proximally along the medial shaft of the first metatarsal bone. The metatarsal flares slightly at its base and meets the first cuneiform bone to form the first metatarsocuneiform joint. As you continue moving proximally along the medial border of the foot, the next large bony prominence you encounter is the navicular tubercle. The medial side of the talar head is immediately proximal to the navicular. You can find it by inverting and everting the forefoot. The resultant motion between the talus and navicular is palpable. Eversion causes the head to become more prominent as it juts out from under the navicular. If the talar head is difficult to find, draw a line between the medial malleolus and the navicular tubercle, bisect the line, and probe that area. The head of the talus lies directly under your fingers. When the foot is in its neutral position, it feels like a slight depression. From the head of the talus, probe proximally until you come to the prominent medial malleolus, the distal end of the tibia. Start at the medial malleolus to palpate the soft tissue depression between its posterior aspect and the Achilles tendon. Within this depression lie several important soft tissue structures. From anterior to posterior, they are tibialis posterior tendon, flexor digitorum longus tendon, posterior tibial artery, and the flexor hallucis longus tendon. The order of these tendons can be remembered by the mnemonic Tom, Dick, and Harry: tibialis posterior, flexor digitorum longus, artery nerve, and the flexor hallucis longus. These tendons are held in place by the flexor retinaculum, which runs from the medial malleolus to the calcaneus. The medial collateral or deltoid ligament of the ankle joint is palpable just inferior to the medial malleolus. The spring ligament attaches to the calcaneus and runs forward to the navicular. Return to the medial malleolus and palpate the long saphenous vein, which is also visible immediately anterior to the medial malleolus. The adductor brevis tendon attaches to the medial calcaneus and runs to the base of the proximal phalanx of the great toe. The first MTP bursa is over the head of the first metatarsal and the first MTP joint. The head of the fifth metatarsal bone and the fifth MTP joint are situated at the lateral side of the ball of the foot. Probe proximally along the lateral shaft of the fifth metatarsal to its flared base, the styloid process. Behind the process lies the cuboid bone. Within the groove between the cuboid and the styloid process of the fifth metatarsal lies the peroneus longus muscle tendon as it runs to the medial plantar surface of the foot. Move proximally along the foot's lateral border to the calcaneus, which is subcutaneous and easily palpable. The lateral malleolus is located at the distal end of the fibula. The peroneal tubercle lies on the calcaneus distal to the lateral malleolus. The tubercle is a significant landmark because it separates the peroneus brevis and longus tendons at the point where they pass around the lateral calcaneus. There are three clinically important ligaments which comprise the lateral collateral ligaments of the ankle joint. From anterior to posterior, they are the anterior talofibular ligament, which runs from the anterior portion of the lateral malleolus to the lateral aspect of the talar neck. the calcaneofibular ligament, which stretches plantarward to its insertion into the lateral wall of the calcaneus, and the posterior talofibular ligament, which originates on the lateral malleolus and passes posterior to the posterior aspect of the talus. The peroneus longus and brevis tendons pass immediately behind the lateral malleolus as they cross the ankle joint. The brevis is closer to the malleolus as it passes, while the longus lies just posterior to the brevis. To palpate them, have the patient actively evert and plantar flex his foot. The MTP joints are found where the toes begin. From the MTP joints, you can palpate the length of the metatarsals as you move proximally along the dorsum of the foot. The tarsal-metatarsal joints are located at the base of the metatarsals. Proximal to these joints lie the distal tarsal bones. Earlier, we found the first cuneiform and navicular at the proximal end of the first metatarsal. On the lateral side of the foot, the cuboid bone is located at the proximal end of the fifth metatarsal. The second and third cuneiform lie beyond the first cuneiform and cuboid bones. The remaining two tarsal bones are the talus and the calcaneus. The dome of the talus becomes palpable with the foot inverted and plantar flexed and is more pronounced on its lateral side. The calcaneus is easily palpable at the heel of the foot. There are three important tendons and one vessel that are found on the dorsum of the foot and pass between the malleoli. From medial to lateral, they are the tibialis anterior tendon, the extensor hallucis longus tendon, the dorsal pedal artery, and the extensor digitorum longus tendon. The tibialis anterior tendon is the most prominent, as well as the most medial of the three tendons. To make palpation of the tibialis anterior easier, instruct the patient to dorsiflex and invert his foot. Palpate it distally to its insertion onto the medial aspect of the base of the first metatarsal and the first cuneiform bones. The extensor hallucis longus tendon is situated immediately lateral to the tibialis anterior tendon and becomes most prominent when the big toe is actively extended. Palpate it along the dorsum of the foot to its insertion into the base of the distal phalanx of the big toe. The extensor digitorum longus tendon lies lateral to the extensor hallucis longus. Palpate it first where it crosses the ankle joint. Distal to the ankle, the tendon divides into four parts, each of which inserts into the dorsal base of the distal phalanx of the four lesser toes. The tendons become prominent for palpation when toes are extended. The dorsal pedal artery lies between the extensor hallucis longus and the extensor digitorum longus tendons on the dorsum of the foot. The sinus tarsi can be found just anterior to the lateral malleolus. The distal tibiofibular joint lies immediately proximal to the talus. The distal tibiofibular ligament overlies this joint. The medial tubercle lies on the medial plantar surface of the calcaneus. It is rather broad and large. From the medial tubercle of the calcaneus Palpate distally along the medial longitudinal arch past the base of the first metatarsal bone to the first MTP joint. If you press firmly on the first metatarsal, you can feel the two small sesamoid bones that lie within the flexor hallucis brevis tendon. Move laterally and palpate each metatarsal head by placing your thumb upon the plantar surface and your index finger upon the dorsal surface. The plantar fascia is strong bands of fascia that originate at the medial tuberosity of the calcaneus, splay out over the sole, and insert into ligamentous structures near the metatarsal heads in the forefoot. Palpate the soft tissues between each of the metatarsal heads for tenderness and swelling. It is not uncommon to find painful neuromas in the space between the third and fourth metatarsal heads, Morton's neuroma. The plantar surface of the foot is also prone to calluses. The gastrocnemius and the soleus muscles form a common tendon, the tendon of Achilles, which inserts into the calcaneus. It is palpable from about the lower one-third of the calf to the calcaneus. The retrocalcaneal bursa lies between the anterior surface of the tendon of Achilles and the bare posterior superior angle of the calcaneus.